I want to talk to you about a certificate of need that's been filed to build a 6th hospital in Columbia, Missouri. Boone Hospital is opposing this certificate of need, and the state of Missouri has to approve it or has to deny the application, and there's a hearing on July 13th to make that very decision. I'm going to need your help as a representative of Boone Hospital and as a friend of Boone Hospital to help us oppose this 6th hospital. This 6th hospital is being proposed by the Fulton Medical Center. The Fulton Medical Center, located in Fulton, Missouri, is proposing a 10-bed hospital with 2 operating rooms and an emergency department. And they're proposing it to help maintain the strength and vitality of the Fulton Medical Center in Fulton, Missouri, and to serve what they propose is the population base in Callaway County and part of Boone County. That's about 78,000 people. Now currently 80% or more of those people actually receive their care in Columbia, and the thought would be, if you were the Fulton Medical Center, to stimulate your hospital and to provide convenient, accessible health care to the people in the Fulton hospital area. You would want to build and invest in Fulton and invest in your current hospital. But that's not the proposal that's on the table for the certificate of need members to consider. The proposal is to build the 10-bed hospital with an emergency room and 2 operating rooms, actually in Columbia, within 5 miles of 5 existing hospitals, and those 5 existing hospitals already operate 1,100 beds. Those hospitals that currently operate 1,100 beds have an occupancy rate on a daily basis of somewhere between 50 and 65%. So there's a lot of capacity currently in Columbia, in that region where this new proposed hospital is to be built, to accommodate more patients. So you would think, as a Fulton Medical Center individual, you would want the $40 million that this new hospital is going to cost to be committed to Fulton and to the central area in which the population base lives. So Boone Hospital officially opposes this application, the certificate of need application, because we don't think on the merits there is a need in the place where they're proposing to build this hospital for more hospital beds. The reason the state of Missouri has a certificate of need law is to prevent duplication of expensive equipment or facilities, because when we duplicate expensive facilities or equipment, we just add to the increased cost of providing health care across the geographic region. So the state of Missouri, like most states in the country, have a law that require expensive proposals in health care to be reviewed by the Certificate of Need Committee. And they will make a decision as to whether they feel there is a need for this new piece of equipment or this new hospital in this particular case or not. When you propose to build a hospital within 5 miles of 5 existing hospitals who are essentially half full on a daily basis, it seems for most people not to make sense. In fact, most people, when they look at the application that the Fulton Medical Center has proposed, they conclude that you should, if anything, invest money in Fulton to enhance your existing hospital. The Fulton Medical Center is owned predominantly by Nuterra, which is a for-profit healthcare company. Nuterra has a mission of generating dividends for its shareholders, where Boone Hospital Center's mission is to improve the health of the people and communities we serve. Boone contributes more than $2 million a year currently to the county of Boone to be distributed amongst the people that live in Boone County and the people that travel here from mid-Missouri. Those funds are used for bridges, roads, airport improvements, and healthcare services. The profits that Nuterra will generate will certainly go to their shareholders who live throughout the world. So I'm asking you to join me and the teammates here at Boone Hospital Center in our opposition to this idea of splitting away profitable healthcare procedures from the community hospitals like Boone Hospital Center and generating profits from those procedures to be distributed to the shareholders in terms of dividends. The way you can help in this cause is to certainly call your legislators. You can also sign our petition, which is on boone.org. So I'd like to ask you to assist me and all of the Boone Hospital Center teammates in opposing this certificate of need application.